Hi, my name is Lisa, and I'm here to give you a brief overview about what it will be like for you to be a laboratory rotation instructor for our cytotechnology students. You're obviously a competent and successful cytotechnologist who has been trusted to relay imperative information and skills to our cytotechnology student. So first off, I would like to thank you for your dedication and hard work. Educating students in laboratory techniques can seem daunting, so I'd like to take some time to discuss what we typically expect for our students to master during their time at your rotational site. During day one of the student's summer rotation, you will be responsible for teaching them how to process body cavity fluids. The things that we want to focus on most is explaining to the student why certain things are happening at every step and every stage. For example, you'll want to fully explain the purpose of centrifugation and why we can discard the supernatant, separating cells of interest from cells that are uninteresting to us diagnostically, such as red blood cells, and the purpose behind the gradient separation technique of phycohydrate that we routinely perform here in our cytology lab. I would recommend for the morning time to practice with a few finalized fluids so that the student can become comfortable, because although they've had training in theory, this will be some of their first exposure to the laboratory techniques, and we want to ensure at all points in our rotation that the student is comfortable and in a safe learning environment. So I recommend for the morning time the student will arrive at 8 for you to pull some preferably bloody fluids to process side by side with the student. At every step, you can explain the purpose behind why you're doing what you're doing. This really helps the student to cement what they know. And maybe you can process one current case before lunch, if possible, if the student is comfortable enough. And then after lunch, I recommend practicing smearing out slides with lotion. You can even give the student up to 30 or 40 minutes to really perfect their technique. Many times they do not have a smearing technique down, and so we want to maximize the time that they have with actual specimen. That's why we spend so much time teaching them with lotion. We can use some of our discarded slides, some of our spreader slides, to put just a small, delicate amount of lotion and allow them to smear. I would also take the time initially to teach them your technique and what has helped you in learning how to smear for the most efficient possible specimen to look at under the microscope. At the end of the day, after they've practiced with the lotion, you can allow them to process a few more current cases and call some of those cases. Also, you can save some of the sediment from the morning time when you were practicing with finalized cases and smear those out. This will give them the opportunity to experiment with how much pressure they apply to the slide and what kind of effect that has microscopically. The last thing we'll do on day one is go over immunomarkers. This can be a brief overview, but you can teach them how to use the culture counter machine. You can teach them more about immunohistochemistry and immunocytochemistry, and allow them to experience disassembling a chamber and allowing the slide to air dry and not smear. That might be their first experience with not smearing a cytology slide. If you would like, you can stain your air-dried slides with a dip quick stain so that they can have the opportunity to see what monolayer looks like under the microscope. Those are the things that you'll be focusing on the first day. For day 2 of the summer rotation, we would like to outline for the student how to process specimens in which we will not be smearing the slide. It is important on this day to emphasize the purpose behind not smearing. For example, with CSFs, it's a sensitive area to collect from the patient, and with urines, the specimens are typically a bit more scanty than other specimens. So these are some reasons why we don't smear these cases. You'll want to fully explain that to the student to make sure they understand the importance of smearing versus not smearing, and how to think through each specimen they process and be able to provide the highest quality slide for the pathologist to look at. On this day, you'll also want to be sure to explain the purpose of using acetic acid in our urine processing, as well as the purpose of adding RPMI for lymphomas to our CSF cases. The student does have the opportunity to review the procedures, an abbreviated version of our procedures that's easy to understand and going to be presented to them in a simple format. Please encourage them to study these procedures before coming each day so that they can give their best work on the day of their rotation. Additionally, I would like to just recommend you have the freedom to do whatever you feel most comfortable with, but keep in mind that CSF cases are very difficult to recollect should there be an error, and so I would recommend actually just reprocessing a finalized CSF for the first couple of times. Then you can move on to live cases with the student. I would also continue to recommend processing side by side so that you can watch how they perform every task and make sure that they're doing it properly in a safe and good manner, good practice. Additionally, I would say that because urine specimens are not as difficult to recollect, it's probably okay to go ahead and start with live cases for urines, as long as you watch them at every step. And be sure to offer yourself to answer questions at every step as well.
Cameras up, take 2 of special stains, and action.
For day 3 of the summer rotation, you will be reviewing bronchial cases with the student. This includes bronchoalveolar lavages and bronchial washings. You should save bronchial brushings for day 4, as they will be taught together with GI tract brushings. For this day, you will want to emphasize how we process specimens that have been collected with saline. Saline solutions, as you know, do not mix well with the Ficol HIPEC technique, so we need to teach the students an alternative version of eliminating red blood cells from our specimens. First thing in the morning, what you'll want to do is go ahead and call the Special Stains Laboratory and set up an appropriate time for our student to go observe the Special Stains professional actually performing a GMS and iron stain. As a part of what you do during the day, you will be teaching them about our Special Stains setup and overviewing the role of the on-call cytotechnologist and some of the duties of the on-call cytotechnologist, which include the Special Stains setup in our lab. But we have the opportunity to send our student down to Special Stains Laboratory to actually see a GMS and iron stain being performed. So what you'll want to do right off the bat is call the Special Stains Laboratory and inform them that today is the day you would like for our student to rotate through if possible. Typically, they request for us to send the student with a few cytology specimens for them to actually process. They can perform the procedures on control slides, but it's preferable to lump it together with work that they actually have to perform in their daily workload. So you will likely process a few bronchial specimens with the student and then escort the student down to the Special Stains Laboratory. Be sure to show the student how to get back for whenever they're finished, and then they'll return with you. You can still practice some more finalized bronchial fluids, especially if you don't get any new current cases. That's okay to do with the student. Also, because it's day 3, you will have the opportunity to let the student request to process some of the other specimen types that they experienced challenges with in the past 2 days. For example, if it's already day 3 and they've been practicing but struggle with smearing still, you can give them that opportunity at this time, especially if you receive a low volume of bronchioles. As you know, in this laboratory, we don't receive as many bronchioles as some of the other specimens. For day 4 of the student summer rotation, you will be teaching the student how to process brushings of all types, including GI tract brushings and bronchial brushings. Additionally, you will teach them about sputum specimens, although we do not typically receive those in our laboratory. I think it is important for you to go over the process of actually dislodging cells from the brush into our cytology specimen. If you do not have the opportunity to do this due to lack of specimen, please feel free to pull from our finalized cases. Also, you can get a clean brush and a clean metal spatula and allow them to practice doing the action even though it's not a real specimen and it doesn't have real cells. That's perfectly acceptable, and the student will still learn how to process these types of specimens. Another specimen type that you'll learn on day 4 will be body cavity washings. Again, you want to teach them what is the difference between body cavity fluids and washings and how saline affects the processing of our specimens. But those are the main points that you want to teach the student on day 4. Day 5 is going to be the final day of your summer student rotation. On this day, the students should be able to function independently and perform all of the laboratory duties on their own. So what you will be expected to do as the instructor is simply observe and intervene if any error is about to occur. You also want to be available to answer any questions. Even if you notice a hint of confusion within the student, I would encourage you to ask the student what they're struggling with. Oftentimes students feel a little bit of hesitation to ask questions, although they are encouraged to ask questions at all points in their training. We want to continue to encourage them to ask, especially before performing a possibly detrimental action to the laboratory to the laboratory procedure. So please feel free to offer yourself as a resource throughout day 5. Also, it's important to note that some of the students, especially on 4th of July week and other weeks like that, may not actually have a day 5. So if you're training a student that isn't going to be there for a 5th day, please keep this in mind during the beginning parts of the week and allow them extra practice and extra exposure to as many specimen types as possible. Other than that, I would just like to express a great deal of gratitude for the work that you're doing for our students and encourage you to know that you're making a difference in healthcare and you're making a difference in cytology education. Thank you.